Hello, everybody. So, today I'm coming to you with a very important topic. The topic is sexually transmitted diseases, also referred to as sexually transmitted infections. And I'll refer to them as STDs during this video. And at the outset, I would like to, clarify the connection between HIV and STDs. HIV, as all of you must be knowing, is the human immunodeficiency virus infection. And since it is also transmitted sexually by sexual contact, it is also an STD. It comes under the broad heading of STDs. So why STD? Why STD? Is a threat, and why getting treated for STDs and preventing getting STDs is important. Because if you have an STD, your fertility may be affected. You may become infertile. If the lady is pregnant, your pregnancy may be affected. It may severely impact the child also, and your sexual health in general will be severely impacted by these diseases. And otherwise also, if the disease is left unchecked, if you don't get treated in time, then the disease can progress to such a level that your other systems or your other organs in your body may also be affected, and this could lead to a much bigger problem. And among many diseases in the STD, there are those that last lifetime. Of course, maybe under control, but then there are some, especially the viral caused STDs, which can never be cured, will always be with you and will resurface from time to time. So actually, recently I had met a co-worker of mine, a former colleague, an STD counselor. So she's the counselor at the STD Clinic in STNM. The STD Clinic in STNM is attached to the skin clinic itself. So she was telling me that in recent times, the number of STD cases have really gone up drastically, and that she counsels STD patients almost every day. So when I heard that, it was a little alarming for me, because when I was working in STD in STNM until very recently, the number of we never got cases every day. There were STD cases a lot, of course, but they weren't coming every day. So this sudden rapid change in numbers is a little concerning. So I thought I should make a video, just an awareness video to make people more aware that such things happen and STDs do occur. So coming back to STDs, now here in this video I will discuss what are the STDs, how will I know that I have an STD, what are the signs and symptoms, and if I have an STD, where can I go to get them treated, what are the facilities available, and most importantly, how I can prevent for myself from getting an STD. Like, why should I get an STD in the first place? Like, how can I prevent it? So so also I'd like to here to give you a little data on STDs and HIV, so that you will understand the magnitude of the problem. So in every year in the world, every single year in the world, about 37 crores of STDs are diagnosed. So those are the ones which have been diagnosed and treated. There are many who don't even come to the hospital. So 37 crores is only the documented cases. And amongst them, the most of the cases are in young people below the age of 30. And then if you think about HIV, about 44 million people are living with the virus right now, HIV virus, and up till now, about more than 40 million people have already died from the disease also. So HIV, you see, the young people, the people between 15 years and 25 years of age, these are the ones who get the maximum amount of, who contract the virus most of the time. So this young population is so important. The young population, I hope, get to see this video, so that I hope I can reach some young people, so that the age group that is actually being affected by these diseases, that STDs, will be more aware and be more careful. So coming back to STDs, what are the symptoms and signs that you will see if you have an STD? So number one, you may have a discharge from your genitals, which may be watery, bloody, maybe pus, maybe whitish, curd-like. So this could indicate an STD. And generally, the most common, discharge, white, curdish, is fungal infection caused by a fungus candida. And here you have itching and discharge, and it's more common in ladies than in men, and it can occur, to a certain extent without an STD normally also. And a little more serious than that is a bacterial infection called gonorrhea. So gonorrhea is caused by a bacteria, and here the patient will see early in the morning when they get up, they'll see a drop of pus at the urethral opening. Urethral opening meaning the passage through which you pass urine. So at the urethral opening, you'll see a drop of pus, which is a typical symptom. Most patients come to us with that complaint, and this can be associated with burning during maturation and sometimes rarely fever. So when you have these symptoms of discharge, there are other discharges also, but if I go discussing everything, this will become a very long video. So anyway, if you have any discharge from your genitals, please sure to visit a doctor and get yourself checked up and treated properly. Another symptom that you might have if you have an STD is an ulcer. So an ulcer in the genitals can happen, and there are many types of ulcers depending upon the organism that causes them. And amongst the ulcers that we see, the most common are ulcers caused by the herpes simplex virus. So the patients come to us also because the symptoms are quite severe, and then the patient cannot tolerate the symptoms. So the patients present with multiple vesicles. Vesicles means fluid-filled lesions, pani poka. So multiple vesicles burning, oozing from the vesicles, ruptured vesicles, and severe pain, burning, especially in the first episode, first time they get it. So these are herpetic ulcers. And then you have ulcers, other ulcers which have no pain, like the syphilitic ulcer, which has no pain, so the patients may not come to us at all. And so that, that could be again another, lead to another serious condition. And then there are other ulcers also, like chancroid, etc. So you must remember here, I'd like to mention that herpes and other viral, infections are transmitted sexually, like HIV also, like HIV, like hepatitis B, like these conditions, you cannot be completely cured from them. They will be there throughout your life, So of course, HIV and all this treatment is extremely good, and a person living with HIV can live a long, healthy life also under medication. But the disease is there, like hepatitis B, hepatitis C, herpes, all these diseases will be there. And anytime you have an immunocompromise, or you have a disease, or you some sort of stress in your life, this may resurface again. So coming to the next symptom will be enlarged lymph nodes. In the local language we call them girka, lymph nodes. So the particular group of lymph nodes will be involved, the inguinal lymph nodes we call them, and they are placed between the junction of your upper thighs and your lower abdomen. So then the lymph nodes may be enlarged, they may be painful, they may not be painful, they may be rubbery, they may be ulcerative, they may be like an abscess, So these lymph nodes can indicate a sexually transmitted disease. But then again, you must remember that these lymph nodes are the lymph nodes that drain the lower portion of your body. So they can be caused by other infections and other conditions besides STDs also. Then the fourth symptom that you might experience is lower abdominal pain. Pain in your lower abdominal, with or without discharge, etc., without an ulcer. But generally, these lower abdominal cases are a result of not addressing your initial problems, like when you have a discharge, or when you have an ulcer, when you have itching, etc., and then you ignore them, you do not take treatment, then these infections can ascend up into your reproductive organs and then cause a condition in the lower abdomen, which results in pain, etc. Another condition, which is skin condition, which may be transferred due to the fact that during physical contact the bodies come into contact. So by virtue of physical contact, these skin infections may be transmitted. Amongst them, the common ones are, the disease that we commonly see in other normal persons also is scabies, pediculosis, tumora, pediculosis, and molluscum contagiosum, which is a viral infection. So you must remember that these are also seen commonly without sexual contact also. But in STDs, what happens is they are localized around your genitals, in your pubic area and around your genitals, and in large numbers in a severe condition. So these are the symptoms and signs that you generally see if you have an STD. So if you have any of these signs and symptoms, and you've had a recent sexual contact without protection, it's always better to see somebody and get treated. So there are facilities for STD treatment in all health facilities, including CRH Manipal. But in STNM hospital, there is a STD clinic attached to the skin clinic, and it is a very good STD clinic. You have experienced doctors, an experienced counselor. So you can be sure that if you go there, your privacy will be maintained. That no one will go talk about your condition to anybody else. And you can go to the doctor and see whether you really have the STD or not. And then if you do, you will be treated. And then you can go to the counselor, and the counselor will counsel you. The counselor will tell you about STDs. She will answer any questions that you may have, and she may allay all any fear that you may have. And another thing is, she'll get you treated for other STDs also. Because if you have one STD, you're obviously prone to getting other STDs also. For example, if a person with an STD has a 20% more chance of getting HIV as compared to a person who does not have an STD. So testing for other STD disease is also very important. So here I urge you, if you have any of these signs and symptoms, please go to the nearest STD clinic in Gangtok STNM and get yourself checked up and treated. Now coming to prevention of STDs, which is the most important part of this video. So in recent times, what happens is the world is changing very fast. There's a lot of socializing, partying. There's people express their sexuality much more openly nowadays, and people indulge in drinking and taking drugs, by which your judgment is impaired, and you tend to be impulsive and make bad choices. And so what happens is people have casual sex without protection. Then some people have multiple partners. Then some people, change partners very often. So, and then some people visit sex workers. Not that all sex workers have STDs, but then the chances will be obviously more there. So it is for the individual themselves to refrain from such activities. Try to avoid any sort of intoxication, so their mind is clear at all times, that you won't make bad decisions. And even if you do indulge in casual sex, please always wear a condom, and be faithful to your partner. Don't keep multiple partners. Don't keep changing your partner. If possible, for youngsters, please postpone your first sexual contact as far as possible, so that the duration of exposure is lessened. And the condom is a very, very effective method of protection to prevent you from getting STDs. So even when you're using condoms, you have to be very careful. You have to buy a condom. Before buying a condom, you should always check the date of manufacture, date of expiry, and then you must know how to use a condom properly. For that, of course, you have Google. If you Google, you surely find instructions as to how to use a condom properly. And most importantly, you must be very mindful and keep a check on your behavior. Like I said, most of the STDs, like HIV, for individuals between 15 and 25, they're the ones who are actually contracting the disease most. That is a very young population. And STDs in general, people below 30 are having the most. So ultimately, it boils down to the younger generation as to how they'll take this disease forward, these STDs, including HIV. And it all depends on how you conduct yourself, how you conduct your behavior in society, how you be mindful, how you talk about the disease, STDs. Like, you should try and break the stigma from the past. Talk about STDs openly with your friends and family. Talk about, advise people to use condom frequently. Discuss how you can curb the disease or prevent further spread in society by being more mindful, by being more faithful, by avoiding multiple partners, etc. And henceforth, for you, the youngster, for future generations, your children, your grandchildren, the future of HIV and STDs in general, whether they'll slowly die out, or whether they will increase multifold and go and become a larger epidemic than it is now. It all depends on how you behave, how you conduct yourself on your sexual behavior. And just for example, there was this study recently that in 2024 there has been 1.3 million new HIV cases. Just imagine, just in 1 year. So the WHO was trying to eliminate HIV completely by the year 2030. But seeing these numbers, it seems like a far cry. But then definitely the chances are still there, maybe beyond that also. At some point in time, if everyone is more aware of STDs, if everyone makes sure that they protect themselves from further STDs, then maybe this sort of disease will slowly, become less and less, and hopefully die out one day. Thank you.